I want to firstly thank all of you for partaking in what we're trying to accomplish. Uh, Now you can go around and tell, if you don't mind, a little bit about yourself. I'll tell you a little bit about me first. I was on the county board for nearly 15 years. I've been with the Winnebago County Action Team, which is what we're part of today, for somewhere between 8 and 10 years. And I like to partake in things like this. So next we'll have Mr. Davis, if you don't mind. And then Bob and Shelton and Dennis Rogers.
Yeah, Bob is just observing, so he's not going to be talking.
Mr. Davis.
Yeah, I'm Ray Davis. I'm a pediatrician here with the Mercy Health System. I've been in Rockford for 33 years, came in '88 and started with the then Rockford Clinic. It's undergone a few transformations over the 30 years. So yeah, I've been around for quite some time working in pediatrics and seeing a lot of the very problem you're talking about. Practice is over here on the west side in the main Rockton Avenue campus, where I've been for 30 years, almost 33 years now. I do also some work with U of I College of Medicine. In 2008, we started a program there for their child abuse program. So I've been the medical director of that program since 2008 as well.
Thank you, sir. Shelton.
I'm Shelton Kay, Vice President of Community Relations at Crusader Community Health. I've been with Crusader for 28 years. I oversee the social service programming, which is known as Community Connections, also the healthcare for the homeless, as well as community outreach.
Thank you, sir. Jen Callison.
Hi, I'm Jen Callison, Director for Women's and Children's here at Swedish American. Most of my bedside practicing time was spent over at Mercy Health, and then I've been here at Swedish American for the last 4.5 years in leadership for Women's and Children's. I've worked with many of the Illinois quality initiatives in the past, and I enjoy working with any initiative that supports women and children's health. So I'm glad to be a part of the team.
Thank you so much. Let's go with Jessica.
Hi, everyone. I'm Jessica Conway. I'm a clinic manager here with Mercy Health. I help run the practice of Dr. Davis, so just here to help support in any way that I can.
Thank you very much. Geneva Stoner.
Genevieve?
Genevieve. Is she on?
Hi, this is Genevieve. Hi, can you hear me?
Yes.
Yeah. A little bit about
Hi,
yourself.
Okay, Genevieve Stoner. I'm the manager of the OB department here at OSF St. Anthony.
Thank you.
And I've had the luxury of working at a few of the different agencies that are on the call today as well, and just here to support.
Thank you very much. Denny Rogers.
Denny, we can't hear you. Unmute yourself, Denny.
Okay, all right, can you hear me now?
Yes.
Yes.
Okay, thank you. My name is Denny Rogers. I am the maternal fetal medicine doctor director at Mercy Health, Javon Bay. And so my interest is and focuses on improving the outcomes of maternal mortality in the Black community, and trying to make sure that we continue to advance any initiative that would assist in decreasing the risk of morbidity and mortality to moms in our community. So I've been a physician with Mercy Health for over 11 years now, and I've been the director of the department for over 6 years. So thank you for the invitation. I look forward to seeing how we collaborate and get these initiatives going to decrease the morbidity and mortality for our community.
Okay, thank you. Jessica? Is she there?
Hi, Jessica.
I already went for me. I don't know if there's another Jessica.
We only see one, that's your name. Can you tell us a little bit about what you do and?
Sure. So I'm the manager for Dr. Davis. So here with Mercy Health, clinic manager.
Mercy. What's your last name, Jessica?
Conway?
Oh, we asked you that, didn't we? Okay.
Yeah.
All right.
Thank you, Jessica.
Thank you.
Yeah, no
so
problem.
much. So here, we've started this, and the way I've got it outlined is we'll hear from our leader, Leandra, and then Harlan will come in and he'll give you some information. And then we'll get back to Leandra. She will have a question and answer session and closing. So again, thank you for showing up, and we do appreciate you. So Leandra, please.
Thank you, Mr. LC. Hello, everyone. I am Leandra Hudson. I am the community co-chair for the Winnebago County Action Team. I am also a program manager at Youth Services Network for our Parenthood Promise program, who provides resources for family that lives in the Ellis Heights neighborhood. A little bit about the Winnebago County Action Team. We fall under NIU and DCFS PEP, which is Permanency Enhancement Project. So we are one of many action teams within the Northern region who work together and work with our community to tackle the disproportionality of children of color that are in foster care. A few years back, we were given the direction from the then former, she's now the former director, Walker, of DCFS, to tackle issues pertaining to youth birth to 3. So her issue with it was there were a lot of child deaths, there were injuries given to children, but they all ranged under the age of 3. So I don't have my PowerPoint shown, but I'm going through some numbers. These are some old numbers from that directive. But her main concern came from, there were 524 children from age 0 to 3 between December 2016 and 2017 of children that were indicated as victims of serious harm or injury. 264 children passed away. And there were 143 of those children were previously found probable for unsafe sleep. So her initiative originally came during the time of Matthew Jenkins and Samaj Crosby. I'm not sure if you guys are aware of those children. They were found deceased in their home. So that was where her initiative came from. She wanted to tackle these issues for these youth at these age. I mean, a lot of them, they can't really speak for themselves. So a lot of the situations that came from those 2 children were it raised awareness of the lack of resources for the families. There was not awareness of available resources. The knowledge of safe sleep practices was not really given out a lot. The transparency and understanding of DCFS and POS process and rolling homes, and then the meaningful contact and support. So I think in 2018, we decided to reach out to the healthcare providers in the area to tackle the infant mortality. Our main concern was decreasing those numbers, giving resources to those families of mothers who were pregnant, who probably did not have the accurate resources that they needed, and providing them with different information. So who better to give that information than our healthcare providers? So we are very excited that you guys are with us. I just wanted to give a little background, as I said, of where our initiative came from, and just to give you a little more insight of how long we have been trying to tackle this issue at this moment. Harlan, I do know you have some fun facts to share. So I'm going to pass the torch to you, and I'll be back for the question and answer.
Thank you. I think we've introduced pretty much everyone else. Bob is here to observe. That's why I'd introduce him. I'm going to share my screen. There we go. And I'll tell you a little about me first. I've been with the Winnebago County Action Team for 20 years. I was, and I'm there as a representative of the NAACP. And we've been working to try to deal with the disproportionality of children who get put in foster care, remain in foster care, and never return to their family of origin. And we haven't accomplished as much as I'd like to in that area. But we then recently got this additional challenge. And you all have a copy of the 2020 Infant Mortality Report. I spent a few hours going over it and using my marker to identify things. And I want to just highlight these things because this will give you some ideas. You may know all this stuff already because you guys are experts. But between 2000 and 2018, Black infant mortality rate has been 2 to 3 times as high as white, Hispanic, and Asian Pacific Islander infants. The rate was the same as low-risk white women. If the rate had been the same as low-risk white women, 212 infant deaths would have been prevented each year. And you can see this graph. That's the only graph I put on, but it's in the book. Key factors are maternal health, prematurity, safe sleep practices, breastfeeding, and injury prevention. Black infants were 6 times as likely to die as white infants of sudden unexpected infant death. It's increased by 38% between 2009 and 2018. Targeted strategies are needed. Illinois infant mortality of all races is rated 36 out of 50 states in 2018. Nothing to be proud of. In 2018, 145 live births in Illinois, 943 babies of all races died before the first birthday. Infant mortality rates have declined for all races, but for Black infants, after a 25% decrease between 2000 and 2008, infant mortality has not decreased. It's remained the same, no reduction. Although women age of 19 and higher and younger had a higher infant mortality rate, it was also much higher among infants whose mothers had birthed 3 or more previous children. Another surprising fact I didn't include in this is that women who were born in a foreign country and came and immigrated here have a much lower mortality rate for their babies than American women who've been born in America. Key maternal health factors are pre-existing conditions such as obesity, hypertension, and diabetes, smoking during pregnancy, and worst of all, lack of any prenatal care. No surprise there, huh? Of protective factors, breastfeeding is the greatest, a 10-fold reduction in risk. That was a surprise to me. Although poverty increases risk, maternal education is not a protective factor. Another surprise. Infants born to Black women who didn't graduate from high school are 50% more likely to die than white infants. But among women with BA or higher, the child is 139% more likely to die. Chronic stress, environmental factors, and other social systems need to be explored. I think daycare is a big issue there too. Total fetal infant mortality rate among low-risk white women was 3.6 per 1,000 live births. Among Blacks, it was 12.1 per 1,000 live births. The report breaks this down further. Increasing utilization of quality health care services is crucial. Systemic factors include a woman's ability to be healthy and have a healthy pregnancy. During the infant health period, preventing assault, homicide, and motor vehicle accidents, and promoting infant safe sleep, breastfeeding, injury prevention, and access to a medical home are key. I'm not sure what they mean by medical home. Prevent accidental suffocation, emphasize that babies sleep alone on their backs in a safe and empty crib. The greatest opportunities to protect Black babies are prematurity prevention and sudden infant and unexplained infant death prevention. We need to identify and utilize existing resources, including the ILPQC, a Birth Equity Initiative, the Illinois Task Force on Infant Mortality and Maternal Maturity among African Americans. I'd never heard of that organization before. Fetal and Infant Mortality Review, and the example from the Chicago Department of Public Health's Chicago Family Connects Home Visiting Program. We may have something similar to that, but I'm not aware of that. This report was an Illinois study. We need to identify and support existing resources in our area. And you've read my emails, how it spells out so much of the areas that go way beyond what a healthcare system can do, but enable people to make use of the healthcare system, everything from transportation to where people live, et cetera. So this is basically a way of our introducing ourselves to each other and paving the way, and then maybe setting a date for a follow-up meeting where we hope to do a little more homework beforehand and get moving. That's all I have to share.
Okay, so thank you, Harlan, for your facts. I am now going to open the floor to anyone if they have any questions or comments pertaining to anything that was shared between Harlan and myself.
It's your time, Leandra.
Okay, well, it doesn't seem like anybody has any questions or anything. So as Harlan mentioned, we brought you all together. We would like to see how the Winnebago County Action Team can partner or assist you guys with any initiatives that you already have set forth in regards to tackling infant mortality. If you have any ideas or any ways that we can assist within the community, we would like to tackle this issue, and if we could tackle it head on, that would be great. But as I stated before, we can't do it alone. We are not experts in this field. You guys are. So we would love to partner in any way possible with your organizations and you all, if you have any ideas on how we can do so.
Yeah, I'd like if we could hear from any of you to tell us where you may know a lot more than I've shared, you know, or you may not, and you may be involved in organizations that we're not aware of. And I don't know that all of the health systems have met together to work. Has that happened at all among all of you? So, you know, silo is not the way to go when we're dealing with this stuff. We need to connect. So I'm glad we're doing this because, you know, we're all connected. All three hospitals and Crusader on this Zoom meeting, and that itself is, to me, an important accomplishment. Yes, Jen.
I was just going to say, I think following like the Illinois, the ILPQC, their birth initiative would be a good start. They've kind of already invented the process, you know, so it takes a lot of the work out of that process, which is nice. And having a history with them, I can say that it does allow for working together well. And, you know, I think it'll be great if we can all reach out together, all three health systems, to see what the community needs. So that way we can come together as a group to provide that. Much easier than one facility at a time. I agree.
Thank you. Anyone else?
I have a couple questions. First, and this can be for anyone in the panel. One is that is the specific. I know that the topic mentioned infant mortality and maternal mortality, but Leandra, when you just spoke, you specifically mentioned infant mortality. So is that the actual goal, or is it the combined goal of trying to decrease infant mortality and maternal mortality and morbidity, or is this really just focused more on infants? It's okay if it is. I just want to make sure that I understand.
Initially, we were focusing solely on the infants, but if we can also find a way to tackle maternal mortality, that would be awesome as well. I'm open to both.
The former state representative in Illinois gave a presentation at the Roscoe Library about how her life was in danger when she gave birth. And, you know, a person of that stature being in that much danger says this is definitely an area that needs to be dealt with. And I'm aware that this is, you know, we can't do it, but you guys can't do it either alone because you're healthcare systems, and we're talking about a community organizing effort. So there may be 3 or 4 or 5 specific task groups that eventually we'll come up with. And I'd like you all to think about that before our next meeting so we can identify what they are. And then I find people who will do that. And then I'm also talking with a couple of organizations, asking them to to write a grant so they could hire someone who would be paid to herd the cats, to help us all work together with each other and coordinate this effort. Because this is a big, a huge task, but the stakes are very high. We're talking about the lives of a lot of people. And also, if there's any research anyone has about Winnebago County, and I have not yet really worked to get the health department going because they're so busy with the virus, but they may know a lot too. And go on.
We need to let Denny ask her second question, if you don't mind. She had the first question been, what was your second question?
Yeah, so my second question was, what is your specific vision in terms of what it is that you would need either from either one of our health systems or from us individually as health professionals? So there were a lot of things that were outlined in that presentation by Mr. Johnson. So thank you for that. Those facts are always very key and important to constantly remind ourselves of. I think that though the problem that I've seen with just trying to tackle this, and not with this organization, but is because I think that there really needs to be some specificity, right? So we can talk about a lot of things on a larger scale, but when we really talk about what it is that how we can partner and how we can help the community, I think that there really should be some very specific things. And it could very well be that, your organization is on the way to doing that, but I didn't know if you have something very specific that, you would like to see, or very specific changes that you would like to see made, things that we can accomplish quickly, that will help address the bigger issue or to address the overall issue. But I guess, how can we be specific in terms of being very deliberate and naming what it is that you would like to see us be able to produce either at the next meeting or think about in specifics?
Leandra?
Thank you, Elsie, for that.
You know me, girl.
I love that you asked that question. Honestly, I can be honest and say I really don't know. I think that's why we're asking you all if there's any way that we as individuals that work with the families in the community, as far as raising that awareness, how can we take on that task?
Yes.
I think that's pretty much what we're looking for. I don't have a clear idea of how to tackle it. I think that's why we brought you all together, because you guys have more experience in this field and know exactly what the families, the mothers, what all they need to know in order to keep themselves healthy, as well as decreasing that main issue.
Put another way, Danny, congratulations. You're in on the ground floor. We got to put this together, and we don't know enough to know. Yes.
Raymond wants to speak. Raymond Davis.
So, listening to all this, I think back a few years back when I worked with on a project once before similar to this, the numbers were the same then. This is probably 10 years ago through U of I, and nothing's really changed. And one thing that struck my mind, part of our program here with U of I and Merit program in the child abuse aspect is, some grants we received. And I know that there was a grant also given by the Club Blue Foundation that sponsored a program called the Doula. Don't know if anybody's familiar with that one before, but a phenomenal program, because they assigned basically like a public health nurse or similar advocate for a pregnant female to help them as they go through pregnancy, but they don't stop there. They continue for the first 2 to 4 months after delivery.
Exactly.
And when you look at infant mortality, especially if you look at, the first 24 hours is the highest. That's in the hospital. That's pediatricians, OBs. That's the pregnancy part and what we get at the time of delivery. Prenatal care is the most important determinant of the first 24 hours. After that, it starts to become more pediatric area, and then the follow-up there. So, campaigns about teaching them about infant crying, not shaking babies, being there to support. You know, you saw the survey that showed breastfeeding, and as pediatricians, we know that. Yet many times they bail. You know, WIC is easy, it's free, it's and it's an easy commodity to switch and make a bottle. But where doulas are present, you can extend that. So there's a lot of opportunities, I think, and some things that have already been looked at that have been shown to be successful. The question is, how do we roll that into a collaborative effort that we get to the different systems, and how can they, well, I'll tell you, I heard you mention, you know, maybe looking to see if there's grant funding or something like that. I think that, you know, maybe getting somebody who's been involved with that doula program before in to talk and see about a larger grant funding for more of that might make a big impact.
That's very interesting because I've been talking with people. I've been aware of doulas for years, and I'm aware of a very good program that's been there with Children's Home and Aid. And one of the people working there, I know, just lost her job because they got defunded from a lot of things. I don't know whether that's affecting their doula program or not, but they might be a natural organization because of their focus on doula and also on Parents Care and Share, which picks it up after 3 or 4 months, where they have been getting groups of parents together to support one another and not just learn from those smart social workers, but rather really get involved, you know. So anyway, thank you, Raymond. Were you going to say something else, Ray? Okay. We're off to a good start.
Miss Hudson, do you want to kind of tell everybody when our next meeting is? And you,
Sure.
please.
Yes, we meet, the action team meets every second Tuesday of every month. Right now we are meeting via Zoom. Our next meeting will be held April 13th at 2 p.m. I do believe we have everyone's contact information. So just in case you guys would like to join, I can include you guys in on that Zoom invitation. And feel free to join us on April the 13th.
And if anyone wants to contact me before then to put me to work doing some specific things, just give me a call or email me, and I'll do what I can. As you can see, I'm pretty passionate about this thing. And many of you are too, I'm sure. Well, thank you all.
Yes.
I'm sorry, I had just one more quick question. I apologize. I know I initially said 2.
Go right.
My question is, can you just share with us, or just maybe comment, what your involvement is so far in the community? Just because I think that this is really an exceptional opportunity to get in early to try to, you know, address these issues that, you know, have long plagued the community. So I really think that this is, you know, an exceptional idea. But I guess my question is, can you just talk about like maybe some of the things that you've done in the community, or like your presence in the community, just so that, you know, as we're coming up with ideas, we know how to best tailor those to, you know, to kind of to be alongside of what you currently already do for the community and your presence in the community.
Okay, so as the action team as a whole, we pretty much try to attend different events to provide the different resources that Rockford has for the residents that live in Winnebago County, I guess. A few years back, we held a symposium that had different agencies.
We had a lot of attendance. That was a great time that we had at the symposium. We had speakers. We had most of the organizations that deal with child care and that, they showed up.
But the focus of that was the disproportionality of children in foster care, not infant mortality.
But she asked some of the things we've been doing. And
right, yeah, exactly.
So we've done that. We have been involved in attending different school family nights. Of course, with COVID, that has put a hold on a lot of how we get our information out to the residents in our communities. I, for one, working with Youth Services Network, I try to connect different resources with the families that live, like I said, in the Ellis Heights neighborhood, which is on the Rockford's west side. So I try to give those resources. That's pretty much how I am, my foot on the ground. Sorry, my words are getting all kinds of loopy-loop. So I pretty much say we try to tackle the preventative measures
Okay.
of things. That's usually how we have been doing things. That's how we are in the community. I don't know. I hope that answered. Sorry.
Yeah,
We
several
have
of us are involved with our ER 815, Eliminate Racism 815, and NICNI's been doing some wonderful things. They've got some wonderful workshops doing that. And I've been involved at Fairgrounds for about 15 years. I was going there every month with a group that met there.
The Peace and Nonviolent Committee met there until we stopped. That started after the Barmore young man that got shot in the church, and we carried that on through 2018, I think. So roughly 9 years.
Yeah, through the NAACP, there are several initiatives that are being planned. One that will deal with encouraging the Chamber of Commerce to become more focused on inclusion and diversity and equity and justice. And another one looking at the history of the number of Black men who've been killed by white policemen and getting the truth out with regard to that and seeing where that would go in terms of how we might rearrange our structures so that the structures would be more humane. So there's a lot of things we're involved in at different levels, at different stages.
I see we got another participant, Jenny Wolf. What's your Wolf something?
Hi, this is Jenny. I'm the system director here at Javon Bay Hospital Mercy Health. I manage both labor and delivery, mom, baby, and NICU departments. Well, I'm the director of those areas.
Great.
We also have Jennifer Wessel on the line here as well. She's our new OB manager. So she's newer to our crew, but she's the manager of L&D and mom baby units.
Okay.
Thank you.
Leandra, did you want to
I can ready. Oh, close. I
this
just
off?
want to
Our
make sure.
intent was to make this a long, lengthy kind of. But
I'm with you, Elsie. So I'm going to close. If we don't have any other questions, I just want to thank you all once again for taking the time out of your busy days to meet with us, to listen. I will include you guys in our next action team meeting when I send out the Zoom link. So please feel free to join to meet the rest of the team, to ask any other questions you have of the team as well. As I stated, that is April 13th at 2 p.m. I'm closing. I'll let you guys go. Thank you guys once again. Thank you, Elsie. Thank you, Harlan.
yes, thank you.
Thank you, Leandra.
Thank you all.
Thank all of you again.
Any other closing thoughts?
Thank you.
Okay. Bye, everybody.
Bye.
Bye.
Bye-bye.
Thank you again.
So, Elsie, it's just you and me and Bob. Bob, you can talk if you want.
What did you think? I want his opinion. Bob?
Yeah, hold on. I had to unmute myself. Well, I